President Joe Biden is set to sign an executive order on Monday that aims to promote the advancement of women's health research. The order will focus on strengthening data collection, as well as providing improved funding opportunities for biomedical research. But before we go to the good stuff, please use some time to like this video and hit the subscribe button. Despite constituting half of the population, women's health has historically been underfunded and understudied. It was only in the 1990s that the federal government mandated the inclusion of women in federally funded medical research. Prior to that, scientific studies predominantly focused on men. Currently, research often fails to adequately account for the differences between women and men, particularly in relation to illnesses that affect women more frequently. The executive order by President Biden seeks to address this issue by bringing about necessary changes, according to his aides. Dr. Carolyn Mazur, the head of the White House Initiative on Women's Health, expressed the need for more knowledge in effectively preventing, diagnosing, and treating various health conditions that affect women. President Biden emphasized his belief in the power of research to save lives and provide high-quality health care. The executive order also acknowledges the political significance of women, particularly during an election year, as efforts are being made to organize and mobilize female voters through the leadership of First Lady Jill Biden and the White House Initiative on Women's Health Research. The announcement comes at a time when the repercussions of a Supreme Court decision overturning federal abortion rights are being felt, impacting medical issues for women who did not intend to terminate their pregnancies. In certain states, such as Alabama, a judge's ruling has raised questions about the future of in vitro fertilization, IVF. Women played a crucial role in President Biden's election in 2020, with 55% of their votes supporting him, according to AP Votecast. Black women and suburban women were strong supporters of Biden, while former President Trump had a slight advantage among white women and a larger share of white women without college degrees, based on an AP survey of over 110,000 voters. Furthermore, the National Institutes of Health, NIH, is launching an initiative focused on menopause and the treatment of menopausal symptoms, which will identify research gaps and work towards addressing them. White House advisor Jennifer Klein provided this information. President Biden and First Lady Jill Biden were expected to announce these measures at a Women's History Month reception held at the White House. Given that certain conditions present differently in women and men, such as heart disease, and that some conditions are more prevalent in women, e.g., Alzheimer's disease, or exclusive to women, e.g., endometriosis, uterine cancers, and uterine fibroids, there is a pressing need for further study, as highlighted by Dr. Mazur. Insufficiently diverse research can have significant consequences. In 2020, a study conducted by researchers from the University of Chicago and the University of California, Berkeley revealed that women were experiencing side effects and being overmedicated due to the fact that dosage trials for common medications predominantly involved men. Thank you for watching. Before you go, please leave your thoughts in the comments section, subscribe, and stay tuned for more updates.